You know, one of the many problems our young people are facing, especially today, is mental health issues. We've got Dr. Edgar Finn, a board-certified child and adolescent psychiatrist with AltaPointe Health, joining us now to talk a little bit more about this. Thank you so much for being here.
I'm glad to be here.
Yeah, of course, this is a very important topic. And like I was saying, in today's time, especially now, mental health is so important to young people.
Yes, it is. And I think understanding how mental health issues arise in children is one of the more important things that we try to educate not just the public, but also we educate medical students and residents and fellows who are in training to be mental health professionals down the road.
So when should parents be concerned about their child's mental health or concerns there?
There are a lot of ways to answer that. The way that I have found perhaps most helpful is to think about a child having difficulty as having a problem with development. Children are always developing, they're never static, and so children that are developing should be growing and getting taller, for instance. They should also be developing psychologically and socially. All those things are moving kind of in context of their particular age and their community. And so I often consider problems that come to our office as difficulties with some sort of development. Maybe it's a development of some psychological coping skill that they're needing to develop. Maybe it's a social skill that they're needing to develop. And so I think whenever we see that children are having difficulty developing those skills that are age appropriate, that's when we need to have a concern.
How young can these issues begin?
Well, it really depends on the issue, obviously. There are some children in the preschool years who have developmental issues, like, for instance, I know you all have talked to speech and language pathologists who talk about the development of speech and language. And so those issues usually show up in the preschool years. Problems like ADHD oftentimes wait until children get to school, and once they're in the school classroom, that's when the problems start to develop. Anxiety disorders can develop at any point in time. There's some disorders like schizophrenia and bipolar disorder. They tend to wait until late adolescence to develop. So it really depends on the disorder.
So when should you seek that professional help?
I think getting back to that development aspect, I think when you see that there are issues with forward movement of development being impeded in some way, like there's a stumbling block in the way of a child moving forward in life, whether it be psychological development or social development or even cognitive development. Those kinds of things need to be addressed, and there are various ways to do that, starting with getting some help from a counselor, for instance.
And talk about that with AltaPointe, how you guys can step in to help. What are some of those programs?
Oh, there are lots of programs that are in place for children. Outpatient-wise, we have outpatient clinics. We also do a lot of in-school therapy. We have a lot of therapists who are in the schools who can work with children in the school classroom and sometimes help parents to avoid having to take off work and bring their child to a clinic, for instance. We have doctors like myself that prescribe medications sometimes, or sometimes the most important thing we do is we help parents understand the problem itself and what kind of things can be done to address those issues and to help the child get back on track. We even have residential programs and an inpatient hospital for the more serious issues.
How can folks find more information? Real quick, we're out of time, but where can folks go to find more information about
AltaPointe.org or call 450-2211.
All right, Dr. Finn, thank you so much for being here. Again, a very important topic and issue.